Welcome to Healing with Fat-Soluble Vitamins. This is the class 2 of 6 on vitamins and minerals and do we need them. There is a lot of ideas about vitamins, whether you should take them as a supplement or if you get enough in your food. And we go over that in class 1. So if you did not see that, you can go ahead and stop this video, go to that one, or you can continue with this video and later on go to why we need vitamins and minerals and if we need to supplement. So this is the second class in a series of 6, and each class is going to be on its own, so you can, it's not like it builds from one to the other. There's going to be information that will be valuable in each video, and if you want to share these videos with other people, they're absolutely free, and I encourage you to do that because there's been a lot of misconception about vitamins and the need for them, and a lot of wrong information about the foods we should eat. So hi, I'm Mary Bourne. I'm a traditional naturopath and I love sharing natural remedies with people. Natural remedies have been around for hundreds, even thousands of years because they work and they work on humans. So food is our medicine, and a lot of the vitamins and minerals we need should come from food sources. And unfortunately, we've been given a lot of bad information about different foods. So hopefully this presentation will clear up some of the misconceptions that we've had and make it clearer of the type of food that you should be eating. So the fat-soluble vitamins are A, D, E, and K. They're found primarily in fatty animal foods such as deep ocean fish, whole fat dairy, eggs, and meat with fat. So there are also nutrients found in plant-based, but these are considered precursors. In other words, your body has to do some conversion for it to use these particular vitamins. And if it doesn't have the tools to do this conversion, then you're going to be deficient in them. And the body stores these in fat. So if you don't have enough fat on you, you can't store them very well. And that can be a problem to some people, but for the most part, not necessarily all of us. So some general properties, they're used to protect fatty tissues from oxidative tissue damage. So let's pick apart that word, oxidative. What happens when you leave a nail out in the rain? It's going to rust, and that's called oxidation. If you leave something out in the sunshine and it discolors or gets whiter, so to speak, that's also oxidation. So it's the chemical reaction of oxygen on the element that is being exposed. So it is critical for the health of the fatty tissue of the brain to have these protection in that can support this and stop the oxidative stress, or at least slow it down. So we want to prevent oxidation of cholesterol, because really cholesterol is not the problem. It's oxidized cholesterol that is the problem. That's what causes plaquing and the hardening of the arteries and the stiffness of joints, and the lubrication in our body needs fluidity, and oxidation stops and inhibits that fluidity. So we can think of it as an insulator or a lubricant. So if you're a gardener like I am, you occasionally have to oil your tools. You'll have to give them some protection. And my husband recently realized that the grandfather clock he put together needed lubrication. It was not chiming like it should. And so maybe we're not chiming like we should because we need some better lubricants. So now, tendency to deficiency, Weston Price, who are talked about in session 1 a great deal, and you can find more information linked below in the description. So Weston Price found indigenous diets contained about 10 times more fat-soluble vitamins than Western diets. Now, we've been led to believe that fat will make you fat, but actually there are diets now that are based around fat that help people to lose weight. So that really flies in the face of that information. Now, Weston Price believed that one of the primary reasons Americans were suffering more from problems with their bones and teeth, because he was a dentist, and were more subject to infectious diseases, was because of this lack of fat in our diet. With the continuing push to avoid animal proteins, especially animal fats, people today are very likely to be deficient in these vitamins. And you know, we went through this crazy thing where the government kept telling us that fat-free was good, our low-fat diets were especially heart healthy. It's just such a wrong and big disservice to people, because there are some fats that are not good for you, like in fried foods and things that fat that has been oxidized, like when in a deep fryer, then the fat's been reused and reused and reused, it becomes like a plastic. And those fats are bad for you. Margarines and things that have been hydrogenized, they are not good for you. Your body doesn't use them as food. But things like grass-fed butter is wonderful for you. So some of the indications that we have this low-fat problem is cardiovascular disease. Now, that's the #1 killer in America. Neurological disease, well, falls right fine behind it when you think about Alzheimer's and ADD. Even, you know, what children are suffering from these low-fat diets. Children need fat, their brain needs fat, and I think our brain needs fat too. This low cholesterol thing that people are going through, it is criminal, because we need fat, but we don't need oxidized fat. So we have problems with the health of our bones and teeth. Many people who go on these medications for lowering cholesterol end up with osteoporosis or hip, 5 years after they've been on one of these cholesterol reducing medications, they end up having to have hip or knee surgery, and nobody is looking at why. And it's just taken for granted. Oh yeah, you know, you get to a certain age and your cholesterol's a little high, but you know, we'll take a cholesterol reducing drug. And nobody's looking that, well, you're a lifetime client now because you're on this drug. So you're gonna have things that are continually going wrong with you. So some specific soluble vitamins can be, fat soluble, can be helpful for eye disease, skin disease, bleeding disorders, clotting problems, and when you have poor wound healing. So let's look at some of these individual fat soluble vitamins. So let's talk about vitamin A. Now, the primary fatty form of vitamin A is retinol, but vitamin A also comes in the form of retinol, retinol ester, and retinoic acid, retinoic. Say that 5 times. These forms of vitamin A are only found in animal foods. And you know what? You don't have to look for each one of them. Nature knows enough to balance these out. So you're going to find all of them in butter that has been from grass-fed cows. Now, also liver, organ meats in America has been really downgraded. I can remember as a kid eating liver and onions, but I bet, you know, I never served it to my kids. So I'm sure that there is generations who have never eaten organ meat. And there are ways now to make it that it really tastes good. Now, this may not be the best news for vegetarians, but we're going to give you some hope in just a little bit. So eggs are a wonderful source, especially if the chickens are pasture raised and they are out in the sunshine and they're eating grass and worms and bugs and veggies that are thrown into the coop. So fish liver oils. Now, many children remember growing up on spoonfuls of cod liver oil, and that they were a lot healthier by it. But in recent years, we found that the quality of those oils has been, the oceans have been contaminated. And so unless you have a good source, somebody who really checks for these heavy metals, it's kind of a chancy thing to just buy fish liver oil off the shelf. Now, one of the ways I love to get this vitamin A is through ghee. Ghee is where the milk solids have been taken out of the butter, and you have left a very shelf-stable, wonderful oil that has a high burn thing. It's so much better to cook with than olive oil. Now, butter and cheese made from whole milk is also good. So we've been told, you know, gotta do the 2% thing, or even a 0.5%, and we're robbing our brains of this good fat nutrient that is available in whole milk. Now, make sure that it's pasture raised cows, and that the milk is coming from a good source. And I can talk about that in just a minute. So carotenoids, this is the plant form of vitamin A. A healthy body can convert carotenoids to retinol, but an unhealthy, especially liver, cannot. And it's found in many colorful fruits and vegetables, including carrots, from which it gets its name. And carotenoids are valuable antioxidant compounds. So when we talked about things that are oxidative, that they can cause damage, antioxidants stop that from occurring. So they're very important compounds, and they will be one of the lessons in this session class. But they don't have all the properties of retinol, and there is just the easiest way for the body to uptake vitamin A is in the form of retinol. Now, the conversion, lack of it is partly genetic. There are some people that simply can't do that conversion. Other factors that interfere with this process are eating low-fat diets, the hypothyroid. Now, here in Michigan, we're inland, and we don't get sea vegetables or sea spray, or we don't go and swim in the sea. And so we don't uptake that wonderful sea salt that is beneficial for the body. And so we end up with a lot of hypothyroid problems, and I combat that by taking sea salt. I love Redmond sea salt. It is a wonderful full mineral salt. It's pink, and you can get it in fine and coarse, but yeah, I love Redmond. It's a American salt, and these days it's important to support America. Zinc deficiency and diabetes rather is one of the things they have a hard time converting because their liver is already challenged. So zinc deficiency is another thing that is, we found that people are very zinc deficient. It was one of the things that is recommended by the doctors to prevent viral replication in the sinuses and in the head. So if you can stop the replication of that virus within the first 5 days, then you will have a much milder case, if any. Now, inflammatory bowel disorders, my goodness, I think more people come to me with inflammatory bowel problems than any other problem. And a lot of times it's emotions. A lot of times it is the food they eat, that they're not giving their body the nutrients necessary to heal the gut. So here are some really dumb recommendations. The adult males are recommended to get 900 micrograms or 3000 IU, and adult females 700 micrograms or 2350 IU per day. Now, in no way is that going to support somebody who is deficient in vitamin A. So therapeutic doses up to 5 times higher. Remember, indigenous people took 10 times higher in fats than the average American. So when you go 5 times higher, we're not even approaching half of what the indigenous people were consuming. And that is completely safe. 5,000 to 10,000 are a good therapeutic dose. The carotenoid equivalent, if your liver is able to do that, would be 8,300 to 16,600 micrograms. So, and it's best taken with D. You know, in nature, there's no separate thing. The D is in carrots, and in beets and many other vegetables that you would find other A's. Vegetables are complex and they have wonderful nutrients in them. And so are eggs. I mean, there's a complexity of nutrients available in those. So if you take with a meal that contains fat, it's better for you, obviously, because that's where the vitamin A is going to be stored, is in fat. Now, vitamin A toxicity, it's highly exaggerated. The research that was done with a person who had a compromised liver, and they found that out after the study. But then, of course, you know, after the fact, things do not get promoted like the first wave of caution or excitement about something harming you. So about 30 to 60 cases of vitamin A overdose are reported each year. Now, that doesn't mean death. That just means the fact that they had some kind of response. And most of these are people with alcoholic livers. You know, you need the good liver to convert and utilize vitamin A. So signs you've taken too much A would be headaches, hair loss, itchy, red skin, enlargement of the liver, and joint pain. However, there's a lot of those particular things that are involved in many allergic responses, not just the fact that you've taken too much vitamin A. However, if you have taken too much vitamin A, one of the ways to know would be to stop the vitamin A. And if the symptom discontinued, you were on the right track. Oh, now eye problems, vitamin A is important for eye health. And in this country, we have a really, really bad problem with eye health. The dry eyes, night blind, just watch the advertisements, you know, and even actual blindness can be due to the fact that we don't have enough vitamin A. So we can use it internally for improving night vision, floaters, glaucoma, macular degeneration, cataracts, red irritated eyes. All have some studies that prove that there is a vitamin A deficiency in this country particularly. Now, it can also be used internally for eye infections like conjunctivitis and styes. And while along with that, I'll often use silver gel, and it has been a wonderful thing. If I have something that's coming erupting, I will put a little bit of silver gel on it, and generally speaking, within 24 hours, that has gone away. So it is a really good idea to keep your body healthy with particular supplements. Now, if you want to look at fighting infections, vitamin A is helpful for fighting infections, particularly those involving mucous membranes in the skin. So sinus infections, sore throats, bronchitis, and look at all the skin things: chickenpox, measles, mumps, whooping cough. You know, a lot of people, all of those 4 things are things that we get vaccines for. And maybe they were originally because people were vitamin A deficient. I'm just saying here. So, and tonsillitis. So other possible uses and support would be if people were neurological conditions like autism, cervical dysplasia, cystic breast disease, endometriosis, Lyme disease, mental illness, radiation exposure, you know, cell phones, the 5G cell towers, and that we are becoming more and more A deficient because of the technology that we're using. And then the vaccine side effects, you know, they are more severe when you are A deficient. So let's talk about vitamin D. The most widespread nutritional deficiency of all the fat-soluble vitamins is vitamin D. 70 to 90% of Americans are vitamin D deficient, and it's so easily fixed. So it's made from cholesterol when your skin is exposed to UV radiation. So again, the need for cholesterol, and it's been demonized, plus the fact that in some areas you don't see the sun all winter long, and then when you do, you slather yourself with sunscreen and stop the availability of this vitamin to be converted by the skin. So, and then people with a high melanin count, like darker skinned people, are going to have a harder time converting the vitamin D from the sun than lighter skinned people. So, you know, we've been hit with so much misinformation about what our body needs, and all these taboo things, creating fear and misunderstanding, that you don't know who to really rely on anymore for information. But most of this information is old school. People knew about this, and they knew how important these supplements were, as the indigenous people did. They lived naked out in the sun, so they had no concerns about cancer and all that, because they ate these high fat foods that protected their skin from the harmful rays of the sun. Now, there are different forms vitamin D comes in. Vitamin D2 is found in some mushrooms, but it's unfortunately been synthetically produced to fortify milk and other foods. And it's not a form that our body can utilize. It is more important to convert from the sun through the skin, through the liver to the kidneys, but most of us cannot do that. And so in taking vitamin D3, which really is that conversion occurs from the skin to the liver, it converts in the liver. But if you're already taking D3, the liver looks at it and says, "Oh, I can use you here and there and everywhere." And so it can already use it. It's a much more active form than D2. And it's only found in animal foods, primarily in oily fish, fish liver, oil, the egg yolks and liver. It is a really important nutrient. And if you're vegetarian, you're probably deficient in it. And it may be causing you some problems that you don't even know are related to that. Now, you can also get it from lanolin, which is from the lamb's wool. And that's probably the purest form, New Zealand lamb. So here we go, ridiculous amounts again for vitamin D, adult male 10 milligrams, micrograms rather, 400 IU, which is like barely touching the surface. You are not going to raise your dose, raise your intake, well, not intake, but your D levels at that rate. So even like recommendations for optimal health is not necessarily a therapeutic dose, because if you're already extremely low, you need to take higher levels of that. And how you know that is through getting a vitamin D test. And they are getting more common than ever. Most doctors will do them. If your test comes back at a 35 to 45 NGL nanograms per milliliter, then you are pretty well set, unless you're seeing some deficiencies. And most doctors that are in health are recommending above 80. Excuse me. So if your test comes back and you're in the 80 to 90 range, you're usually doing a much better job of supporting your bones and your teeth. So the calcium absorption is promoted by vitamin D, and it's done in the intestinal tract. So if you have an unhealthy intestinal tract, you're not going to do this conversion. And it's important for the bones and teeth to have levels of calcium and phosphorus in the blood that are supportive. This is an important supplement for osteoporosis or other bone problems, such as helping broken bones heal, and arthritis, and teeth that decay easily. So some doctors recommend that taking K2 along with D3 helps to get the calcium into the bones in a greater way. So viral infections, oh my goodness, has that not been the topic for the last 2 years? And maybe it's because we are so D deficient, who knows? But it plays a critical role in preventing and overcoming viral infections such as cold and flu. And other infection, mumps, Lyme disease, pertussis, staph infections, tuberculosis, and typhoid. Lower levels of vitamin D3 in the winter months correlate with cold and flu season, and they also correlate with mood disorders. So people who are, they have seasonal affective disorder, a lot of times if they have their D levels checked, they find that they're way in deficient in vitamin D. So adequate levels of vitamin D3 help with both preventing and recovering from serious viral infections. Now, a recent study suggests that no one who had adequate levels of vitamin D3 in their blood died from COVID-19. That's a hugely interesting thing. How about autoimmune? Well, vitamin D acts as an immune modulator. So a lot of people talk about boosting their immune system, but maybe that's not what you need. Maybe what you need is an immune modulator, because if you boost your immune system, you're liable to ramp up your symptoms, whatever autoimmune condition you're dealing with. So for example, if you're dealing with Lyme disease and you take echinacea, you may in fact ramp up those symptoms. Whereas if you take vitamin D, that won't happen. So it may be helpful in protocols for Lou Gehrig's disease, Hashimoto's thyroiditis, lupus, and multiple sclerosis. So if you are having any of these conditions, adding vitamin D might be a thing that you would want to look into. Now, how about heart disease? Oh my goodness, this country, the #1 killer is heart disease. Heart attacks increase during the winter months when vitamin D3 levels are lower. So along with other fat-soluble vitamins like E and K2, it helps maintain the health of the arterial linings. It prevents hardening of the arteries, and it helps maintain normal blood pressure. So these are all very important. And again, as I mentioned, seasonal depression. If you get depressed during the winter or when it's always cloudy or rainy, you may find vitamin D3 helpful as well. So low levels contribute to seasonal affective disorder and a form of depression brought on by lack of exposure to the sun. I know myself that when the sun is out, I have a lot more energy. So the brain and nervous system, it helps protect brain and nervous tissue, as well as it may be helpful for vitamin D is helpful for autism, schizophrenia, Down syndrome, mental illness, peripheral neuropathy, and Tourette's. Now, vitamin E refers to a family of fat-soluble vitamins called tocopherols. Alpha tocopherol is considered the most active form. Plants also contain beta, gamma, and delta tocopherols, all of which have beneficial actions. So in getting a complete vitamin E supplement is really where you want to go. Now, vitamin E is found in many plant foods, including wheat germ oil, sunflower seeds, almonds, hazelnuts, peanuts, peanut butter, and a variety of fruits and vegetables. So now if you have nut allergies, you may be having a vitamin E deficiency. Now, if you have an E deficiency, it's considered rare, but when you look at all the conditions that vitamin E can help, they're not so rare. Now, here's some really dumb amounts for adult men is and women is 15 milligrams. This is about 1,500 milligrams of D-alpha tocopherol. Now, let's talk about the type of vitamin E, because there is the natural form, which is D-alpha, and there's the synthetic form, which would be represented as DL. So if you look on your vitamin supplement and it says that the vitamin D is derived from DL service, like Daniel Larry, those are synthetic and they are causing more problems, the studies say, than natural vitamin E. So you want to make sure that you're taking the natural form. So in the natural form, it's relatively non-toxic, but high doses of anything can create problems. Now, it prevents oxidative damage. Again, here we go with that word. And it's important that we do prevent that, because it can cause damage. It's almost like lightning hitting a tree. So the polyunsaturated fatty acids create this kind of damage. So we want to make sure that we're eating whole fats. It helps control gene expression. So there is something that's called a genetic wrapper, and this wrapper protects that gene from being expressed. And once the wrapper, which happens during oxidation, is exposed, then we have all these genes that are expressed that can contribute to a whole bunch of problems. So it inhibits platelets from sticking together. So that's really a good thing. Now, heart disease, while studies have found that people who consume more vitamin E than those who don't have found that they are their heart is healthier. So it may help with angina, arteriosclerosis, heart fibrillation, the palpation, that's when you feel the heart in your chest beating really hard, and hypertension. So vitamin E and wound healing. Now, topically, we've used vitamin E topically for years. We used vitamin E ointment, and it has been extremely, we use it every winter to prevent the cracking and chapping of the your gums, your teeth, your lips, all of that are subject to the cold air, and they can be damaged. And so I just put a little bit of vitamin E on my lips every morning, and that really prevented that from happening. I used to have terrible cracking and bleeding in the edges of my mouth, and all of that has gone away. So, and you can take it internally as well for protecting against scarring after surgery or injury. And also zinc. Zinc has been well known for helping wounds heal better. So you can help your body by using nutrients. Hopefully you've learned some things about how vitamins can be helpful and whether or not you need them. So let's just, as a review, we'll have a little sponsor discussion here. Nature Sunshine is the company I use and highly recommend to my clients. And it is guaranteed for quality and for purity. They go through extreme care in giving you the best nutrients that are available. So vitamin A for eye and skin health, vitamin D3 for structural and immune health, vitamin E complete for heart health and skincare. And remember, I talked about getting the vitamin E, all the components of it, to do the best you can. And then you can, if you want, an all inclusive is the super trio, and it has super supplemental, which has your vitamins and minerals. It has super omega-3, which is your good fat that's necessary, and super ORAC, which is a really high intensity antioxidant. And there is a link in the description below for a 25% discount on your order. So let's talk about vitamin K. This is our final vitamin that is fat soluble, and it comes in the form of K1 and K2. And it has several forms that most research by they're called MK4 and MK7. So there's been a lot of interest in science now about this particular vitamin. Vitamin K1 is found in high concentrations in a variety of green vegetables like turnip greens, kale, and spinach. And vitamin K2 is only, again, found in animal foods, but it is the most available and metabolized by the body. Again, K1 has to be converted in the liver. So, and good healthy gut bacteria is also important in this conversion. So it will transform K1 to K2. So metabolized in the liver, transformed in the gut. And here's some ridiculous amounts again. Of K is 120 micrograms. The standard dose for the treatment of osteoporosis in studies is 45 micrograms of K2 daily, even though lower doses have proved helpful. So vitamin K1 and K2, even at very low doses or high doses, have not shown toxicity. Now, there is a concern when you're taking blood thinning medication because it does interfere with the uptake of that. And remember that a lot of times it's a deficiency that's creating the sticky blood that's creating this situation with the cells clumping together. And it is much better to take nutrition, but you need to talk to your doctor about that and see if they're willing to help you downstep and move into nutritional sources rather than taking the medications. So vitamin K1 and K2 do not interfere with heparin and antiplatelet agents like aspirin, Plavix, and direct thrombin inhibitors like Carotenoids and Activator. Now, in 1945, Dr. Weston Price described a new vitamin-like activator that played an influential role in the utilization of minerals, protection from tooth decay and growth and development and reproduction and protection against heart disease and the function of the brain. And he called it Activator X. While using a chemical test, he determined that compound, which he called Activator X, occurred in the butterfat, organs, and fat of animals consuming green grass, and also in certain seafoods such as fish eggs and fish who ate algae. So through this discovery back in 1945, we understood the need for D3 and K2. So Dr. Price used vitamin D3 and his Activator X to cure many diseases by giving people cod liver oil and grass-fed butter from spring grass. So remember, I said my form of great fat would be the ghee, and the organic valley is a great source for this. So vitamin K in the body, there is a high concentration of vitamin K in the brain. So the brain needs it. Pancreatic cancer has been hugely on the uprise for several years now. The salivary glands. K2 may help prevent neurodegeneration such as Alzheimer's. There's lots ongoing studies now, and it may also be an enzyme activator. So without enzymes, nothing happens. Now, K1 is essential for normal blood clotting. K2 also helps with blood clotting, but is also helpful for bone health and immunity. So really, K2 is the way you want to go. And Nature Sunshine has a wonderful source called krill with K2. So you want to take it with fats, and krill is a great fat. So K2 is used with D3 to strengthen the bones in cases of osteoporosis and to also improve dental health by drawing calcium into the bones and the teeth. So we don't want calcium in the blood. We want it in the bones and in the teeth. So it also inhibits tooth decay. Now, vitamin K in this study called MK4 also appears to prevent and even reverse the deposition of calcium in the arteries. Remember, we don't want calcium in the blood, we want it in the bones, and it's associated with heart disease. It also supports the immune system and helps to reduce the risk of cancer. We are still learning many of the properties of vitamin K2, that there's some ongoing studies about the importance of this nutrient. So as I mentioned before, food is our medicine, but it can also be our downfall. And if you're not paying attention to your diet and you being cognizant of the fact that you need to be feeding yourself good nutrients, maybe taking a supplement is the best way to go. Also, there's a wonderful channel called Mary's Nest, and I can link that in the description below. And she uses a lot of the recipes in Nourishing Traditions, and she works you gradually from a processed kitchen to a traditional foods kitchen. And you can learn all kinds of wonderful things about making bone broth and ferments and just sourdough. She's just a plethora of great information and great recipes. And she just simplifies it. So I will link that in the description below. I'll also link Sally Fallon's book and the discount code that you can get for your supplements. And I hope that this has been very informational for you. If you want to make sure you're getting the nutrients while you're correcting your diet, you can follow that link for the super trio that I talked about. I hope that you've enjoyed this class. Also, I hope that if you have a concern, that you email me, Dr. Mary at bornforhealth.com, and that you have a greater idea of fats and how important those fats are to your health. So watch for my next class in this series of 6 classes. Until next time, this is Dr. Mary for the Health of It.